My name is Dr. Rashmi Halker Singh, and I'm the online social media editor for the Headache Journal. And I'm joined today by my good friend and colleague, Dr. Beth Robertson from the Mayo Clinic in Rochester, Minnesota, who has curated this current virtual issue on cranial neuralgias. Welcome, Dr. Robertson.
Hi, thank you for inviting me.
So, can you please explain to our viewership what exactly is a virtual issue?
Yeah, I'm really glad you asked that question because I did not realize that the Headache Journal had these until recently, and they are awesome. So virtual issues are collections of previously published papers that are put together into various topics of interest. So in the past, these collections were really comprehensive so that if you, for instance, had a resident or a fellow and you wanted them to read about nerve blocks, you could send them to the virtual issue and it had all of the papers over many years on nerve blocks. And I am starting to send our trainees to those, but the format has changed recently. And so now instead of this comprehensive issue, we were asked to put together kind of briefer, more recent articles. So now they hold roughly 10 papers and they're from the last few years. So for instance, there's a COVID-19 virtual issue available for people if they wanted to look.
Yeah, I think the point is to kind of have the latest knowledge available right at your fingertips on a theme. So you put together our cranial neuralgias issue for us. And when you did that, did you see any themes emerge with this whole topic?
Yeah, I've really enjoyed reading all of the articles, trying to decide and pick 10. Um, Most of the articles do revolve around trigeminal neuralgia. I think we see most of that. So I tried to include topics on different presentations for trigeminal neuralgia, some novel treatments like botulinum toxin into the SPG, for instance, or some topical medicines or kind of different options there. And I thought there were some interesting cases that I included that really helped me in my clinical practice. And then there are also some articles on other neuralgias, some more terminal branch neuralgias like auriculotemporal or great auricular neuralgia, just kind of reminding us that trigeminal is not the only nerve to consider.
So at this point, I think you can consider yourself one of our experts on neuralgias, given everything you've learned putting this together. So, what are some of those clinical pearls that you were able to glean from this virtual issue?
I think one of the things that I thought was really interesting was that I have in my mind, I'm sure we all do, some red flags that make me question the diagnosis of trigeminal neuralgia. So for instance, if a patient presents at an early age with bilateral symptoms, or if they're not responding to medicine, I start to automatically think about alternative diagnoses. And one of the articles included in the issue discussed that these are features commonly found with familial trigeminal neuralgia and in patients with Charcot-Marie-Tooth. So now when I'm hearing that early onset or the bilaterality, I start to question their feet and any history of length-dependent neuropathy, and that certainly wasn't anything I did before. There was also an article talking about the pediatric presentation, and they had more supraorbital presentations, which again is something that kind of makes you rethink trigeminal neuralgia, and it's an interesting concept that it sort of expanded what normal was for me, if that makes sense. So.
That's really exciting. You gave us a couple examples of how this has, impacted your care of patients. Are there any other ways that you've, changed your clinical practice based on what you've learned?
There's actually a case report that I included that did change my clinical practice. It was a case by King and colleagues, and I hate saying this, but I did somehow accidentally miss their original publication. But it was a case report on a patient who had had sinus surgery and 12 years later was presenting with neuralgic symptoms that were isolated to the superior alveolar nerve. And it turns out that they had developed a delayed post-operative cyst in their maxillary sinus, and it was tickling the superior alveolar nerve, but it was creating neuralgic pain that would be prominent when they would bite down or chew or brushing their teeth. And it resolved, their pain resolved when that maxillary cyst was removed. So I don't know about you, but I tend to kind of ignore sinus cysts, those polyps and cysts that are incidentally noted. I don't even think about those. And this woke me up to the fact that those can sometimes aggravate the nerves locally and that they can be caused by sinus surgery. And all of that was new information to me. So I was really glad that I had a chance to go back and see that.
Well, thank you so much for putting this collection together. There's so much valuable information out there. Is there anything else you want to share with us?
I think I just want to make sure that viewers know about these issues. If there are topics that are interesting to them, it's hard for all of us to catch every single publication with every single journal. And I think this is a great way to find those topics of interest and be reintroduced and sometimes introduced to the very first time to papers that have come out that are of interest.
Absolutely. And all of these virtual issues are available online on the Headache Journal. If you go to the main page, there's a tab on the right that says virtual issues, and you can find them all there. So thank you so much for your time today and for putting this together and for your discussion with me.
Thank you.